Can you tell us briefly,
It is.
can you tell us briefly where we are here today?
Yes. So the Federal Ministry of Health has initiated a program to try and ensure that there is a budgetary alignment with health strategies, both at the federal and at the state levels. So essentially what they're saying is that if you have a strategy, you've developed a state strategy to address your health issues in your environment, that it only makes sense that that strategy should be aligned into the budget so that you can implement that strategy. You have a situation where you have a strategy and the budget is speaking to different programs that have not been prioritized in your strategy. And you have a situation where you are not able to implement your strategy to the fullest impact. So that alignment is very important. And it was first presented to us in the National Council of Health in Akin a few months ago, and we've been identified as 3 pilot states, Lagos, Kaduna, and Kano, to pilot the process. And once they've already done some activity at the Federal Ministry of Health, so we want to now come to learn what the experience was at the Federal Ministry of Health and see if we can take some of their strong points and some of their mistakes and adapt it to the state.
Okay, sir.
To do this in Lagos State, but it's always nice to get support from the federal government and to get the emphasis on this process. So we've been trying in our little way in Lagos, but now we're just starting this workshop. And I think at the end of 3 days, we will now have a clear pathway which we can take back to Lagos and strengthen what we've already started.
Okay, fine.
So, as you, this is my second term. So, basically, we're just rolling over our strategies. We've done a number of things. The first thing is we've introduced a blueprint for medical infrastructure transformation. So, we have old hospitals or old designs. We've upgraded all of them. They're new, modern. They're low carbon footprints. So they use as little energy as possible. And we also are digitalizing the health space in Lagos so that we have all health information going into one center. That's something that's going to come on stream very soon. We are also dealing with biosecurity. Lagos is a very congested, tight place. We already have a very strong biosecurity roadmap, but COVID showed us that we still have some weaknesses. So we're trying to strengthen that. Human resources for health is very big for us because our population is expanding and we don't have enough doctors and nurses and allied health professionals. So we have a strategy now to really ramp up the number of doctors, nurses, and healthcare professionals that we can make in Lagos. And to crown it all, health insurance. Very, very critical for us to find alternative sources of financing, health financing. It can't all come from budget. So it must come from budget, it must come from insurance, and it must come from private sector, PPP, public-private partnership, and then our donor partners.